Hi, in this video I will elaborate about the unique features and advantages of the Lubo airway collar. The Lubo is the only non-invasive upper airway opening device that allows the caregiver to open and secure the patient's airway by imitating the jaw thrust maneuver while immobilizing and protecting the cervical spine. Those unique features makes the Lubo the only medical device that combines between an efficient non-invasive airway management and cervical immobilization. As for today, there is no efficient procedure that allows to perform a non-invasive basic airway management for a trauma patient. The common method for any basic life support in order to treat an airway obstruction will be by conducting an invasive procedure using an NPA or an OPA. This procedure will require high skills in order to apply the device and in many cases can harm the patient if inserted incorrectly. The Lubo allows any basic life support to perform an efficient, non-invasive airway management. This allows the doctors and the paramedics to address the more urgent patients in the field, while the lower rank caregivers can address the lower risk patients and provide them with an efficient, non-invasive airway management and immobilization. Another big advantage of the Lubo is what we call the neck-free immobilization. There is a big debate that is going on today regarding the use of cervical collars. The immobilization method of most traditional cervical collars that exist in the market is by grasping the patient's neck. In many cases, this neck grasp might cause pressure against the carotid arteries and jugular veins. Those are two large blood vessels that flows and drains blood to and from the brain. This pressure might cause the patient's intracranial pressure, or ICP, to raise, which can cause substantial damage to any traumatic brain injury or head injury patient. Therefore, as for today, there is an ongoing call among trauma specialists to consider the use of cervical collars due to this problem. The Lubo method of immobilization is neck-free, which means that the collar touches in 6 different spots around the neck: sternum, chin, mandibles, and 2 additional spots at the back of the neck. 1, 2. The Lubo doesn't touch the neck itself and therefore overcomes this common problem that most traditional cervical collars have. More than that, thanks to this unique feature, the Lubo can be applied on a patient in any head position, even if it's tilted down, without the need to raise the patient's head, which might cause damage to the cervical spine. The Lubo is the only collar that allows the caregiver to intubate the patient without taking the device off, and therefore, 1. There is no need to move the patient's head in order to remove the device to execute the intubation, and 2. The Lubo redundant the need of any assistance in neck and head immobilization while intubation is being performed. In order to intubate the patient, all you have to do is to free a little bit from the chin strap, put the chin cap down, open the patient's mouth, and then to regain immobilization, just tighten the chin strap again. And now the patient is both immobilized and intubated. Today, most traditional cervical collars require pre-measurements. If it's to measure the height of the neck or the width of the neck and to adjust the collar accordingly. Unfortunately, incorrect measurements is a common phenomena among caregivers, and this may lead into worse outcome to the patient. The Lubo doesn't require any pre-measurement and can fit most of the adult population in one size. So I would like to summarize everything that we just spoke about. First is the combination between airway management and cervical immobilization. Second is the fact that with the Lubo, any basic life support can perform airway management. You don't have to be a doctor or a paramedic. Third is the unique neck-free immobilization method that doesn't grasp the patient's neck and therefore doesn't increase the ICP. The ability to intubate the patient without taking the device off. And there is no need for any pre-measurements before applying the device. One size fits all adults. That's it, you guys. Thank you for watching.